Hi, we're here at Rotemberg Plastic Surgery. We're going to talk about today on a little topic that can be sensitive for a lot of women. It's labiaplasty. And Dr. Tran and I, we perform the procedure very often here in our office. It's done here in the office under local anesthesia. And so basically, why do we do labiaplasty, right, Dr. Tran?
Right. I think that's a very common question. You know, people think that it's just for cosmetic to make it look better. In fact, that's not true. Most of our patients come here, you know, very much younger patients, you know, late teenage year to women who have children, and their actually main complaint is that because the labia is so large that it gets in the way of them wearing normal clothing.
Yes, and a lot of times you cannot even exercising. When you go bicycling, it's very uncomfortable. Doing yoga, and you know, if you're running, it rubs in your legs, and some patients really, you know, it's a procedure that you really benefit from. Of course, we always have patients that they come here, they don't have that enlarged labia, and we tell them there's nothing wrong with your anatomy, and you don't necessarily need the procedure. Okay, so
Right.
there are criteria that we use to perform the labiaplasty. It's not that any woman that walks in, we're going to do that procedure. You have to be a good candidate for it.
Exactly.
Nowadays, with internet and every woman shaving their pubic hair, that area is more noticeable, but that doesn't necessarily mean that you need to have the procedure. So we're very careful choosing the patients, and they have to be the right patient for the procedures, the one that they really need.
Right. Because we've seen, you know, other patients that come to our office who has a procedure done elsewhere, and you know, they have complications from the surgery because there was just too much tissue removed, so now they have a lot of pain. So I think inducing the patient who is an appropriate candidate for the surgery is extremely important, because it's something that can really change your life in a negative way too if you're not the right candidate.
Yes, and you just have to be careful, especially when they say that they're going to remove everything that is there. You need to have some extra skin. So in order, when you're having intercourse, you need to have some extra skin to stretch.
You need the appropriate tissue to, even for normal movement, for normal stretch of your genital during intercourse. Right. So I think those are very important things that people don't realize that is really important. So you cannot have everything removed, because that will lead to really bad scarring and issues down the line that people, I don't think, realize. So.
Yes, and the procedure, like I said, is done here in the office. Is local anesthesia. We numb up the area first for about half an hour, and then when we go and inject the local anesthetic, you barely feel anything. And then it takes about an hour for all the cutting and the sewing. You stay here for a few more minutes afterwards, just to make sure that there's no bleeding. And do patients have a lot of pain?
No,
not really.
Yeah.
You have pain the night of the procedure. We
Right.
give you pain medications for that, and but overall, patients come here for follow-up.
Yeah, they're usually pretty much, I would say 99% of the patients said that they would take either Tylenol or something a little stronger than evening off, but after that they either just stick to Tylenol or ibuprofen. Some people don't even take anything after that first evening, because, you know, the discomfort after surgery is very short.
Yes, and we see the patients every week for about 2-3 weeks, and then in 3 months, 6 months, and a year. The only thing you have to remember is it will be swollen for about 6-8 weeks.
Mm-hmm.
And we always said that you cannot have intercourse for about 6 weeks, no tampons for a month, no swimming or submerging in the pool or ocean for about a month.
Right. So those are just restrictions that will help you heal up, you know, in an appropriate way without having your stitches open or poor scarring. So it's really important. The other thing I think is tight jeans.
Yeah,
About 2
tight
weeks
jeans.
of not wearing tight jeans, the issue is that the seam is very thick and it can rub the area, so it can cause discomfort. But yoga pants works really well
Yes,
for all of our patients.
Yeah, but the patients are very happy, and I think it builds a lot more self-confidence in most of them, especially the young girls, young women, you know, in their 20s. They're a lot more confident after the procedure.
Right.
So.
I think all of our patients has been very happy. We always ask them, would you have the procedure done again after when they come back for post-op visit? And so far everyone has said they're very happy. They didn't realize that they were anything wrong with it, because I don't think this is something that people talk about. It's just kind of like a taboo, I guess. But everyone is super happy that they've had it done, and they wish they had known that they could have done something about it sooner. So
Yeah.
So, well, if you have any questions, feel free to look us up and email us or call our office.